Here we go. Good morning. Today we're going to be learning about Provision 4 of the ANA Code of Ethics. As an experienced nurse, you've probably learned about the ANA Code of Ethics in your nursing program studies, and it's likely something that you follow instinctually in your daily actions as a nurse. However, we know it's important that we visit this again to make sure that you understand how it acts in your current role as a professional nurse. Okay? So for today, we're going to review Provision 4 of the ANA Code of Ethics, and we're going to reflect on the nurse's role in this provision. At the end of the session today, you'll be able to list 2 ways in which you're responsible for your individual nursing practice. And you'll also be able to discuss 3 tasks that might be appropriate for delegation while ensuring optimal patient care. So do you have any questions? Okay, well let's get started. So the ANA Code of Ethics for Nurses reads that the nurse is responsible and accountable for her individual nursing practice, and then she determines the appropriate delegation of tasks that's consistent with the nurse's obligation to provide optimal patient care. So this provision really has about 4 elements in it. It has a lot of words, and it has several different things that it's communicating. One is about accepting accountability. So that's that the primary responsibility of that you have primary responsibility of the nursing care that's being provided. And the second piece is about accountability for judgment and actions. So this is the nurse being accountable to herself or himself about the decisions that they make and the actions that they take. And then the third piece is about responsibility for nursing judgment and actions, and so that's accepting that role of being responsible and accepting the role and making sure that your competency is there. And then the fourth one has to do with delegation of the activities. So just assessing competency of others and knowing which skills that can be delegated. Okay, so now we've talked about the 4 pieces of the 4th provision of the ANA Code of Ethics. So what I'd like for you to do now is do some reflection. So I want you to use your piece of paper that I've provided to you and think about those 4 areas. And I want you to think about the last shift that you worked and how, was it very busy? Was there anything significant or challenging that happened? And then think about, and I want you to reflect on those 4 elements and how you might have done things differently or how you acted under this provision in that shift. Okay? So I'm going to give you some time to complete that, and then when you're done, we'll talk about it. Okay. Okay, it looks like you're finishing up. So tell me what you were thinking when you were doing this assignment.
The way that I think and the decisions that I make as a nurse carry great responsibility. My patients and their families are relying on me to make good decisions. It is my responsibility to be sure that I stay current on changes in practice and know the skill level of those that I delegate to.
Okay, yeah, and that's a very important thing that we want you to get out of this activity. So after completing the assignment and reflecting on your last shift, and how do you think this will change what you do every day? What are some things that you can do to make sure that you are current with your changes in practice?
Well, I can read my nursing journals and participate in education events here at this hospital.
Okay, that's great. And another big part of this provision is the responsibility of delegation. So what kinds of nursing care tasks will you be delegating upon assuring skill competency?
Well, I already routinely delegate vital signs and ambulation, so I think I will make an effort to observe the skills of my coworkers to be sure that my patients will be safe, because that is my responsibility. I may also consider delegation of intake and output, making sure that our PCTs are competent in this skill as well.
That sounds great. So I hope this activity has been helpful to you.
Thank you, it has.
Great.